He took the long road with his half-torn slippers, past the muddy stream, past the rocky road, past the dying trees, through the wind so cold, as his pregnant wife's clench turned weaker and growls turned milder. Over his hardened shoulder, the clouds turned darker.
There was an ambulance waiting outside her home. Came as scheduled, 9 months in making. Carefully loaded, nurses overlooking. Roads seemingly shaking, the wind puffing big dust, moving steadily but fast. The clocks were ticking. She cried so loudly in pain. Once every 5-minute burst, ultrasound image in one hand and his hand in another. Eyes wide in excitement, hardly blinked, the to-be father.
The 10-year-old closed his eyes, dreaming of cricket, holding his stumper ball, running in the sun so warm. As the needle pierced his tiny arm, they ran every other test after many a hospital visit. Finally, the result came. It's curable, doctors claim, but you'll have to spend a lot. The technology is new and cheap it's not. The father drives an auto, the mother serves food hot. What they need is a mountain, and all they have is a dot.
A woman in her prime, just married, you see, works as a maid in a big city. Alas, she finds a lump on her breast. Shaken and scared, runs to get a test. Cancerous, they say. Fatal if untreated. She shakes her head, feeling defeated. She isn't rich, she says. Doctors claim, don't lose hope. This card is all you need. Funded by the state. Rich or poor, healthcare is free.
70 years and counting, doesn't know his name, doesn't recognize self, dirty and untamed. His home is the roadside, toys are dumpster waste, feeding on throwaways. Children find him amusing, play with him a game they call rocks. Stones thrown with precision while he grins and mocks. For townies he is a reference used when talking directions. Unchanging part of sidewalks, he is obvious yet unnoticed.
Army captain at 30, alcoholic after 10, resigned from work and got attached to his glass and wooden cot, turned athletic to apathetic. Family left him to rot, giving up hope he'll change. He was depressed and delusional, with no one to care. Ate nothing but old monk, rotten chips and despair. He talked with his cupboards, listened to the walls. Sometimes he forgot he can walk on two legs. In his house he would crawl. An old neighbor felt so sorry, joined him in a rehab home. Free treatment for mentally challenged and addicts, as it's a curable syndrome. First few months were agony. Slowly, things started to change. He started to miss his family. They came to visit one day. He fell on his knees and cried. He finally felt okay.
The previous scenarios are written this way to showcase how health disparities can lead to adverse outcomes. These drastic situations are easily avoidable with some collective will and change in policies. Health disparities are avoidable inequalities in health between groups of people within countries and between countries. According to CDC, health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances.
Achieving equity in health requires a societal willingness to address challenges associated with the social determinants of health, including racism and bigotry, poverty, residential segregation, substandard housing, low quality education, limited employment opportunities, lack of public safety, unequal access to and quality of healthcare, and the lack of neighborhood amenities and resources that enable people to maintain and improve their health. To achieve equity, practitioners, researchers, and educators should engage in efforts to enhance strategic thinking, disruption to current norms, and approaches based on evidence. These evidence based solutions should be taken up by leaders and implemented into policies. We, as public health professionals, should be part of it in every single phase to ensure they are cautiously researched, meticulously planned, seriously considered by policymakers and effectively implemented.